which are no external rotation, which is rotating the surgical leg outward, no hip adduction, which is crossing the leg, and no hip extension, which is moving the surgical leg backwards. First, we're going to talk about positioning in the bed with anterior hip precautions. In this scenario, our patient has a left anterior hip replacement. The position she's in now is not okay. Her legs are crossed, and that is breaking her hip precaution of no adduction. So we want our patient to rest with her legs straight, and if needed, we can put a pillow or a blanket roll in between her knees as a reminder to prevent her from crossing her legs. I'm gonna pick it up. When moving our patient over to the side of the bed, we want her to move her legs incrementally instead of swinging her legs to the side all in one motion. So this, she would be crossing the midline, if you imagine a line from her nose to her belly button between her feet, so that's not okay. She can start moving her legs over a little bit, and then her hips need to come with her as she moves the left leg so that it doesn't cross the midline. We would use the draw sheets if we need to help move the patient's hips as we move their legs. Now we're going to talk about using the walker and maintaining anterior hip precautions. We do not want our patient to step forward with the non-surgical leg first, because then her surgical leg is in extension. So instead, your patient should move the walker forward first and then step into the walker with the surgical leg, just like this. When you're walking with your patient and they need to change directions, we don't want them to move in a large turn, like 90 degrees. It should be multiple small steps to achieve the turn. Either direction your patient is turning, they're at risk of breaking their hip precautions if they don't take multiple small steps. So it should look like this. Perfect. Now let's review our anterior hip precautions. 1, no externally rotating the leg, which is turning the leg out to the side. 2, no crossing the legs. And 3, no extending the surgical leg behind you. If you have any questions after watching this video or when you encounter a patient with anterior hip precautions, reach out to a therapist. And thank you for watching our video.